Hi there, my name is Jarrett. I'm 33 years old. I wanted to share my health journey with you guys. When I was 19, I was in the best shape of my life. I'd been playing hockey for a majority of my life, and I was playing college prospect hockey to eventually, play college, and the goal was pro. I weighed 187 pounds. I wasn't a small guy at all. And at the end of the hockey season, I had got a TBI, and that was the end of it for me for hockey. So I spent the next 6 months. First 6 months was just recovering from the TBI. And following that, 3 months later, I was working for Dish Network at the time. And I woke up one morning to get ready for work, and I had never had in my life such severe stomach pain. Without exaggerating, it literally felt like I'd been stabbed or something. Like I thought I had torn my stomach lining or something like that. So I went to the hospital. Didn't go to work that day. Went to the hospital, and they couldn't find anything. And they said that it's something that should pass, stomach bug kind of thing. So it didn't pass. It just got worse. And over the next 4 months on, I had went from 187 to 144, 145. And I lost so much weight in such a short period of time that while I was at work, I was, more than ever, obviously, being drug tested because my bosses thought I was on drugs, but I wasn't. I was just very sick with something the doctors couldn't find. And within those 4 months, I had probably 8 hospitalizations. And, and doctors were taking it seriously because I was losing a lot of weight, and, they had done urine analysis, and they knew that I wasn't on anything I shouldn't be on. And so they knew there was a problem. Over the course of the next 3 years and 8 months from that point, I had accumulated 112 hospitalizations, 13 misdiagnoses, 2 unnecessary surgeries. The diagnosis ranged from Crohn's to fibromyalgia to irritable bowel syndrome to somatoform disorder. They thought that there was nothing wrong with my stomach, that it was just kind of that I just believed that I was in pain, and therefore I was. But there was also nausea. I was throwing up so much all the time. And once I had got down to 108 pounds, I was put on a feeding tube, and I didn't eat a bite of solid food for 2 years, a little bit over, and just did the feeding tube, but further would decline. Along with all those misdiagnoses came medications and stuff like that. Nothing ever helped. Diets, I tried diets, a lot. And when I was in the hospital over the first 4 years, it was like I was living in and out of the hospital. So my hospital visit stays weren't 1 or 2 or 3 days. I would feel like I had been discharged early if I was discharged at a week. So like my average stays were, at least 2 weeks, to a month. There were several stays where I was there 5-6 weeks. And so I just was so sick and so depressed because of how I felt, that I just kind of lost faith, and I remember thinking about, at the time I remember I was 25. Remember like it was yesterday. I just remember thinking there is no way that I can go another 50 years feeling like this, looking at myself in the mirror like this. It was just too much, and it wouldn't end. And I'd been dealing with it for years at that point. My father ended up taking me to Mayo Clinic in Rochester, Minnesota, where I was properly diagnosed. And I was diagnosed with superior mesenteric artery syndrome. It's a super rare condition. There's been something like, last number that I heard was around 10,000 cases, confirmed cases since 1852. So it explains why it is so hard to diagnose. At the time that I was diagnosed, it's been 6 years or 7 years, something like that. And the doctor's familiarity with SMA, superior mesenteric artery syndrome, is probably more advanced than it was then, or at least I'd like to think so. So there may be more than cases in that now. So after I had a surgery, that was a necessary surgery, I didn't gain weight. The pain didn't lower, the nausea didn't lower, but the fat pad in between the duodenum and mesenteric artery was basically narrowed, crimping the mesenteric artery. So the surgery corrected the blood flow problem. How that wasn't detected years prior, after so many hospitalizations, that I had a clogged artery. I'll never know, but a residual effect of years of dealing with that without, remedy left me with extreme pain and nausea. So it just continued. Whereas if it was found, years prior, may or may not have been the case as far as the severity of the symptoms. But after Mayo Clinic, I moved to Texas to be with my lady, and I started doing dog rescue, started my own dog grooming business, but suffering every day chronically. The biggest things for me was nerve pain, was muscle fatigue, energy. It just was chronic, and the severity of the symptoms were just so high. It was just exhausting. And I found that I would think more and more about how this just isn't practical to continue feeling like this forever. I wasn't on a feeding tube anymore. I think I kind of accepted it for a long time, and then eventually it just was too much. I had seen Bernadette when I came over to do her dog's nails, and I had told her what I was going through. Just, I've known her for quite a while now, and so I'm comfortable talking with her about it. And she gave me a response that I definitely did not expect. And that response was, "I can help you." And that's all I need to hear. I mean, I'm all for it. I'll do whatever I have to do just to get out of the suffering that I was in. So I said, "Okay, great. What do we do?" And she says, magnet therapy. And I said, "I have no idea what that is, but that sounds pretty good." So we did magnet therapy, and I went in with my levels across the board at an 8, a 9, and a 10, just really high across the board. And after the session, I was zero. I hadn't felt that in 14 years. That was very strange to me. It was, Bernadette's comment was, "You feel like a normal person right now." And so once I felt that, then I realized that there was hope. So I did a second session with it, and I was even better consistently after the second session. So, at that point, it's just, I felt that we were onto something, and I was completely just dedicated to whatever needed to do to get better. So the next thing that she suggested to me, because I was still having problems regulating my stomach, was a diet change. And this period of time where she had suggested a diet change, I was weighing like 130, and that was, 37 days ago, and 37 days later, I'm 143. So it's not just about the weight, while that is great in a lot of ways, and the whole fact that I'm not withering away anymore is pretty significant. To me, it was just mind-blowing that a diet not only can regulate your stomach. We know this. If we're eating clean foods, it regulates our stomach. But it reverses. This magnet therapy and eating properly has reversed all of the complications that were setting me back. Muscle fatigue, energy, nerve pain, brain fog. It's, I want to say it's all gone, because I feel better than I have in almost half my life. But I have a feeling that it's only going to get better from here. And that is, I can't even explain to you. I'm trying, but I can't explain to you how amazing that is. I just wanted to take the time to share my story in hopes that somebody watching this that is suffering severely, maybe not with SMA, and probably not with SMA, even if it's something completely different, do this. It's going to help you a lot.